Have you ever woken up in the middle of the night unable to breathe through your nose, constantly switching sides on your pillow, desperately searching for relief? What if I told you that there is one simple movement that may help your sinuses drain more effectively and make breathing feel easier within minutes? Most people spend years relying on sprays, medications, and temporary fixes without understanding why their nose becomes blocked in the first place. The truth is that congestion is often not just about excess mucus, it's about poor drainage. When your sinuses cannot drain properly, pressure builds, mucus accumulates, and that frustrating stuffy feeling can seem impossible to escape. In today's presentation, we're going to explore the science behind sinus congestion and reveal a surprisingly simple technique that may help encourage natural drainage. But that's only part of the story. You'll also discover why many common habits unknowingly make congestion worse, how to maximize the benefits of this technique, and the important warning signs that indicate a more serious underlying issue. By the end of this talk, you'll have practical, evidence-based strategies that can help you breathe more comfortably and understand your sinuses better than ever before. Make sure you stay until the very end, because one of the most important tips is something most people have never heard, yet it could completely change the way you deal with sinus congestion. Many people assume that a stuffy nose is simply the result of having too much mucus. But the real story is often much more complex. Your sinuses are connected to small drainage pathways that allow mucus to move out naturally. When these pathways become swollen due to allergies, colds, environmental irritants, or inflammation, mucus can become trapped inside the sinus cavities. As pressure builds, breathing through the nose becomes more difficult, and the sensation of congestion can become constant and frustrating. This is why some people continue to feel blocked even after repeatedly blowing their nose. In many cases, the issue is not the amount of mucus present, but the inability of the sinuses to drain efficiently. Another reason congestion tends to linger is that many people focus only on temporary symptom relief. Nasal sprays, decongestants, and other remedies can provide short-term comfort, but they may not address the underlying cause of poor drainage. Some individuals even develop a cycle in which they rely on these solutions repeatedly, while the inflammation responsible for the blockage remains unchanged. This can create the impression that their congestion is getting worse, or that nothing seems to work for very long. Lifestyle factors can also contribute to persistent sinus problems. Dehydration may cause mucus to become thicker and more difficult to move, while dry indoor air can irritate nasal tissues and increase swelling. Exposure to allergens such as dust, pollen, pet dander, or mold can further aggravate the lining of the nose and sinuses, making drainage even more challenging. Even sleeping positions can influence how congestion feels, particularly when mucus collects in certain areas of the sinus passages. Understanding these hidden factors is the first step toward finding lasting relief, because once you recognize why congestion develops and persists, it becomes much easier to support the body's natural drainage mechanisms and improve overall breathing comfort. To understand why a simple movement can sometimes provide noticeable relief from a stuffy nose, it helps to know how the sinuses are designed to function. Your sinuses are air-filled spaces located within the bones of your face and skull. They continuously produce mucus, which serves an important purpose by trapping dust, bacteria, allergens, and other particles before they can travel deeper into the respiratory system. Under normal circumstances, this mucus drains through small openings into the nasal passages and is cleared naturally without you ever noticing it. The process is efficient, automatic, and essential for keeping the nose healthy and functioning properly. The challenge begins when inflammation narrows these tiny drainage pathways. Swelling caused by allergies, infections, irritants, or environmental factors can reduce the size of the openings that allow mucus to escape. As a result, mucus may start to accumulate inside the sinus cavities instead of draining freely. This buildup creates pressure, discomfort, and the familiar sensation of nasal blockage that so many people experience. Even when there is not a large amount of mucus present, swelling alone can significantly affect airflow and make breathing through the nose feel difficult. Gravity also plays a surprisingly important role in this process. The position of your head and body can influence how easily mucus moves through the sinus passages. Certain positions may encourage drainage, while others can allow mucus to pool and remain trapped. This is one reason why congestion often feels worse when lying down for long periods or when sleeping in particular positions. By understanding the natural relationship between sinus anatomy and gravity, it becomes easier to appreciate why specific movements or posture changes can sometimes help promote drainage and reduce pressure. When the sinuses are able to drain effectively, pressure decreases, airflow improves, and breathing often becomes more comfortable. Supporting this natural process is not about forcing mucus out, but about creating conditions that allow the body's own drainage system to work as efficiently as possible. Now let's talk about the simple movement that has gained attention for helping some people feel temporary relief from sinus congestion. The idea behind this technique is not that it magically cures sinus problems, but that it may encourage mucus to shift and drain more effectively by taking advantage of body positioning and gravity. When mucus becomes trapped inside swollen sinus passages, even a small change in position can sometimes help reduce pressure and improve airflow through the nose. To perform the movement, begin by sitting comfortably with your back straight. Take a slow breath in through your nose if possible, and exhale gently. Next, lean your head forward slightly, and then angle it toward the side that feels more congested. Hold the position for several seconds while breathing slowly and calmly. Some variations also involve gently tilting the head in different directions to encourage drainage from multiple sinus areas. The goal is not to force anything or create discomfort, but simply to allow gravity to assist the natural movement of mucus through the sinus pathways. As you hold the position, you may notice subtle sensations. Some people report feeling a slight shift in pressure around the cheeks, eyes, forehead, or nose. Others notice increased mucus drainage into the nasal passages or throat. In some cases, one nostril may begin to feel more open within a few minutes. These sensations can vary widely from person to person, depending on the cause of the congestion and the degree of inflammation present. It is important to remember that this movement works best as a supportive strategy rather than a standalone solution. If the sinus passages remain severely swollen, drainage may still be limited. However, when combined with proper hydration, humidified air, and good nasal health habits, the technique may help the body's natural drainage system function more effectively. The simplicity of the movement is what makes it appealing, because it requires no equipment, takes only a short amount of time, and can easily be incorporated into a daily routine whenever congestion begins to develop. Many people unknowingly make their sinus congestion worse through everyday habits that seem harmless on the surface. One of the most common examples is spending long periods in environments with dry air. Whether it's from air conditioning, indoor heating, or low humidity, dry air can irritate the delicate lining of the nose and sinuses. When these tissues become irritated, they may swell and produce thicker mucus, making drainage more difficult and increasing the sensation of blockage. Another frequent mistake is not drinking enough water throughout the day. Hydration plays a critical role in maintaining the proper consistency of mucus. When the body is dehydrated, mucus can become thicker and stickier, making it harder for the sinuses to clear themselves naturally. This can contribute to a cycle of congestion that feels persistent even after other symptoms have improved. Many people focus on treating the congestion itself while overlooking the simple habit of supporting their body's natural drainage mechanisms through adequate fluid intake. Sleeping position can also have a surprising impact on sinus symptoms. Lying completely flat may allow mucus to accumulate and increase pressure within the sinus cavities. This is one reason congestion often feels worse at night or first thing in the morning. Slightly elevating the head during sleep may help support more effective drainage and reduce that heavy, blocked feeling upon waking. Overusing certain nasal decongestant sprays is another issue that many people don't tolerate, and many people. While these products may provide quick relief, prolonged or excessive use can sometimes lead to rebound congestion, where nasal blockage returns and may feel even worse than before. This can create a frustrating cycle of temporary improvement followed by recurring symptoms. Exposure to allergens and irritants is equally important to consider. Dust, pollen, pet dander, smoke, strong fragrances, and environmental pollutants can all trigger inflammation inside the nasal passages. When inflammation persists, the sinuses have a harder time draining properly, making congestion more likely to continue. Identifying and reducing these triggers can often make a significant difference in long-term sinus comfort and breathing quality. While the sinus draining movement can be helpful on its own, its effectiveness often improves when combined with a few simple habits that support the body's natural ability to clear congestion. One of the most important factors is staying properly hydrated. Water helps keep mucus thinner and easier to move through the sinus passages. When mucus remains fluid instead of becoming thick and sticky, it is less likely to become trapped inside the sinus cavities. Drinking adequate fluids throughout the day can therefore create a more favorable environment for drainage and may enhance the results of any technique designed to relieve congestion. Humidity is another valuable tool for supporting sinus health. Dry air can irritate the lining of the nose and contribute to swelling, while moist air may help soothe irritated tissues and loosen mucus. This is why many people notice temporary relief after taking a warm shower or spending time in a steamy environment. The moisture helps hydrate the nasal passages and can make mucus easier to clear. Using a humidifier in dry indoor spaces may provide similar benefits, especially during seasons when heating or air conditioning reduces humidity levels. Gentle physical activity can also play a role. Activities such as walking or light exercise may temporarily increase circulation and encourage movement within the nasal passages. Some people find that their nose feels more open after moderate activity because blood flow patterns change and mucus begins to move more freely. However, exercise should be approached according to individual comfort levels, especially when dealing with illness. Consistent nasal hygiene is equally important. Saline rinses or saline sprays may help wash away irritants, allergens, and excess mucus while keeping the nasal tissues moisturized. Unlike medicated products, saline solutions simply support the nose's natural cleaning process and can be used as part of a regular routine for many individuals. Perhaps most importantly, patience and consistency matter. A single technique may not completely eliminate congestion in every situation, but combining healthy habits with proper sinus care can significantly improve drainage over time. Supporting the body's natural processes often provides the most sustainable path toward clearer breathing and greater overall sinus comfort. Although most cases of a stuffy nose are related to temporary issues such as colds, allergies, or mild irritation, there are situations where persistent congestion may signal a more significant underlying problem. Understanding the difference between common congestion and symptoms that deserve medical attention is important because early evaluation can sometimes prevent complications and lead to more effective treatment. One warning sign is congestion that lasts for several weeks without meaningful improvement. While a typical cold usually resolves within a relatively short period, ongoing blockage may indicate chronic inflammation, nasal polyps, structural issues, or chronic sinus disease. If symptoms continue despite home care measures and lifestyle adjustments, it may be worth seeking professional guidance to identify the underlying cause. Severe facial pain or pressure is another symptom that should not be ignored. Mild discomfort can occur with routine congestion, but intense pain around the cheeks, forehead, eyes, or upper teeth may suggest a sinus infection or another condition requiring medical evaluation. Similarly, swelling around the eyes, significant redness, or changes in vision should be considered urgent warning signs because they may indicate complications involving nearby tissues. Recurring sinus infections can also be a clue that something more than occasional congestion is occurring. Individuals who experience repeated episodes throughout the year may have untreated allergies, anatomical differences, immune system concerns, or chronic inflammation that contributes to ongoing symptoms. Identifying these factors can be an important step toward long-term relief. It is also important to pay attention to symptoms that extend beyond the nose and sinuses. High fever, persistent fatigue, difficulty breathing, severe headaches, or symptoms that rapidly worsen rather than improve may indicate that additional medical assessment is needed. In some cases, what appears to be simple congestion can actually be related to other respiratory conditions. The key message is that home techniques and self-care strategies can be useful for routine congestion, but they are not a substitute for medical evaluation when symptoms become severe, prolonged, or unusual. Recognizing these warning signs allows individuals to seek appropriate care, address the true cause of their symptoms, and protect their overall health while working toward lasting relief. Here's a strong final conclusion for your speech. As we conclude, remember that a stuffy nose is often more than just an inconvenience. It can affect your sleep, energy, focus, and overall quality of life. The good news is that understanding how your sinuses work gives you the power to take a smarter approach to congestion. Rather than relying solely on temporary fixes, supporting your body's natural drainage system can make a meaningful difference. We've explored why congestion develops, how sinus drainage occurs, the simple movement that may help encourage mucus flow, the everyday habits that can worsen blockage, and the practical strategies that can support clearer breathing. The most important takeaway is that small changes can produce significant results. Staying hydrated, maintaining healthy humidity levels, practicing good nasal hygiene, and using simple positioning techniques may help your sinuses function more efficiently. At the same time, recognizing when symptoms require professional medical attention is essential for protecting your long-term health. Breathing is something we often take for granted until it becomes difficult. When your nose is clear, every breath feels effortless. When it's blocked, even simple daily activities can become frustrating. By applying the knowledge you've learned today, you can take proactive steps toward reducing congestion, improving comfort, and supporting healthier sinus function. The next time a stuffy nose strikes, you'll have a better understanding of what's but inch strikes. Have a paxaming inside your body and a practical strategy to help you find relief. Thank you for watching, and here's to easier breathing, healthier sinuses, and feeling your best every day.